200 patients, 25 years. One trusted nurse. When the investigation into Linda Patterson's crimes was complete, detectives realized they were dealing with one of the most prolific serial killers in medical history. But the most chilling part wasn't the number of victims, it was how easy it had been for her to kill them, and how long it took for anyone to notice the pattern hidden in plain sight. Linda Patterson worked the night shift at St. Mary's Hospital for over 2 decades. Patients loved her gentle bedside manner. Families trusted her with their dying relatives. Doctors respected her experience and dedication. She received commendations for her compassionate care and was often requested by name by worried family members. But behind her caring smile and soft-spoken demeanor was a calculating killer who had turned healing into hunting. And the only reason she was finally caught was because one doctor noticed that death seemed to follow Linda Patterson wherever she went. If you're into medical crime stories, hospital mysteries, and the dark psychology of those we trust most with our lives, subscribe now and hit the bell icon. April 1998, St. Mary's Hospital, Chicago. Linda Patterson was 28 years old when she started working the night shift in the intensive care unit. She had graduated from nursing school with honors, volunteered at a local hospice, and came with glowing recommendations from her previous job at a smaller hospital upstate. From her first week, Linda stood out. She was the nurse who stayed late to comfort grieving families. She volunteered for extra shifts when the hospital was understaffed. She had a special way with elderly patients. They seemed to find peace in her presence during their final moments. Linda had this calming energy, said Dr. Margaret Foster, who worked with Patterson for over 15 years. When families were struggling with end-of-life decisions, I would always recommend they speak with Linda. She had a gift for helping people find acceptance. But there was something else about Linda that her colleagues noticed, though none of them thought much of it at the time. Patients seemed to die more frequently during her shifts. Not dramatically more, just enough that other nurses occasionally joked about Linda being a death magnet. "We called her the Angel of Death," admitted nurse Jennifer Walsh, who worked alongside Patterson for 8 years. "But we meant it affectionately in the ICU. Death is common. We thought Linda was just unlucky, or maybe she was so good with dying patients that the difficult cases were naturally assigned to her." Linda never disputed this reputation. In fact, she seemed to embrace it. She specialized in end-of-life care, often volunteering to take the patients that other nurses found too emotionally difficult to handle. For 25 years, no one questioned the deaths on Linda's shifts. ICU patients are critically ill. Death is expected. The hospital's mortality rates weren't unusually high overall, and Linda's patients always died of seemingly natural causes: heart failure, respiratory arrest, complications from existing conditions. But in March 2023, Dr. Michael Chen joined St. Mary's as the new head of internal medicine. Fresh out of his residency at Johns Hopkins, Dr. Chen brought with him a background in medical data analysis and a naturally curious mind. During his first month, Dr. Chen began reviewing patient outcome statistics as part of the hospital's quality improvement initiative. He was looking for patterns that might help reduce mortality rates and improve patient care. What he found disturbed him. The numbers didn't make sense, Dr. Chen later testified. "When I broke down the data by shift and by nurse, there was one clear outlier. Patients were dying at nearly 3 times the expected rate during Linda Patterson's shifts, but only when she was directly assigned to their care." Dr. Chen ran the analysis multiple times, thinking he'd made an error, but the pattern was undeniable. Over the past 5 years alone, 67 patients had died under Linda's direct care compared to an average of 23 for other ICU nurses working similar shifts. Even more suspicious, Linda's patients often died during the quiet hours of the night shift between 2 a.m. and 4 a.m., when fewer staff members were around and monitoring was at its lowest. Dr. Chen took his findings to the hospital administration in April 2023. Initially, they were skeptical. Linda Patterson was a respected, veteran nurse with an exemplary record. The hospital's legal team worried about the implications of investigating a long-term employee based on statistical analysis alone, but Dr. Chen persisted. He expanded his analysis to include Linda's entire 25-year career at St. Mary's, requesting archived patient records and mortality data. The results were staggering. Over 200 patients had died under Linda's direct care mortality rate that was statistically impossible given the types of patients she typically treated. When we saw the full scope of the data, said hospital administrator Robert Hayes, we had no choice but to contact law enforcement. We were potentially looking at the longest-running serial killing spree in the hospital's history. FBI was called in to assist with the investigation. Special Agent Sarah Rodriguez, who specialized in medical crimes, had seen cases like this before. Healthcare workers who used their positions to kill vulnerable patients. Healthcare serial killers are among the most difficult to catch, Agent Rodriguez explained. They have legitimate access to lethal medications, their victims are already sick and expected to die, and they understand how to make murders look like natural deaths. Linda Patterson had perfected this system over 25 years. The investigation began quietly. Linda continued working her normal shifts while agents reviewed patient records, interviewed families, and analyzed hospital security footage. They started with Linda's most recent victims' patients who had died in the past year under suspicious circumstances. The breakthrough came when investigators examined the case of Harold Morrison, a 72-year-old patient who had died suddenly in February 2023. Harold was recovering well from routine gallbladder surgery when he went into cardiac arrest during Linda's shift. Security footage showed Linda entering Harold's room at 2:47 a.m. She was carrying a syringe, which wasn't unusual. ICU nurses regularly administer medications. But when investigators examined the medication logs, they found discrepancies. Linda had signed out morphine for Harold's pain management, but the amount she'd withdrawn was far more than prescribed. And toxicology tests, performed as part of the investigation, revealed traces of potassium chloride in Harold's system, a drug that stops the heart instantly. Potassium chloride is the perfect murder weapon for someone with medical knowledge, explained Dr. James Patterson, a forensic pathologist. In small doses, it's used legitimately in medical settings. But in large doses, it causes immediate cardiac arrest. And unless you're specifically looking for it, it's nearly impossible to detect in standard autopsies. Further investigation revealed Linda's methods. She targeted patients who were alone during night shifts with no family members present. She preferred elderly patients or those with existing heart conditions, deaths that would seem natural. She used her access to the medication room to obtain lethal drugs, often disguising them as routine medications. Most chillingly, she kept detailed personal notes about her victims, not in official medical records, but in a private journal found in her apartment. Linda Patterson's personal journal, discovered during a search of her apartment in May 2023, provided a window into the mind of a serial killer who had operated undetected for 25 years. The entries, dating back to 1999, revealed a woman who had developed an obsession with death and saw herself as a mercy killer. March 15, 1999, Mrs. Thompson was suffering. Her family couldn't let go. I helped her find peace. She thanked me with her eyes. October 3, 2001, Mr. Garcia would have lingered for weeks in pain. I gave him dignity. His son will never know how I saved him from watching his father deteriorate. December 22, 2008, the young mother with cancer. Only 34, I couldn't let her children see her waste away over Christmas. She passed quietly, a gift. The journal revealed that Linda genuinely believed she was performing acts of mercy. She saw herself as saving patients from prolonged suffering and sparing families from painful goodbyes. But as the entries progressed, a darker pattern emerged. Linda began killing patients who weren't terminally ill, people who were recovering, who could have lived full lives. June 18, 2015, Mr. Davidson was getting better. But he was rude to the day shift nurses, complained constantly. Some people don't deserve recovery. August 7, 2019, the elderly woman who reminded me of my mother. Always criticizing, always demanding. She won't bother anyone anymore. By the final entries, Linda was killing simply because she could. The power over life and death had become addictive. On June 12, 2023, Linda Patterson was arrested at the end of her shift at St. Mary's Hospital. She showed no emotion as FBI agents read her rights and escorted her from the ICU where she had worked for 25 years. During questioning, Linda initially denied everything. But when confronted with the statistical evidence, the toxicology reports, and excerpts from her journal, she broke down. I was helping them, she sobbed during her confession. I was ending their suffering. Families don't understand they want to keep people alive even when there's no hope. I was giving these people peace. Linda provided details about dozens of murders, explaining her methods and justifying each killing. She showed investigators where she had hidden unused vials of potassium chloride and other lethal medications. The most disturbing part of her confession, said Agent Rodriguez, was how normal she seemed. She talked about murder the same way another nurse might discuss routine patient care. She had completely rationalized what she was doing. Linda's confession allowed investigators to identify at least 200 victims, though they suspect the actual number may be higher. Many of her early victims were cremated, making it impossible to perform toxicology tests. Linda Patterson was sentenced to life in prison without the possibility of parole. She pleaded guilty to 200 counts of first-degree murder, making her one of the most prolific serial killers in American history. St. Mary's Hospital implemented new protocols following the investigation, mandatory dual verification for all medication administration, increased security monitoring during night shifts, and regular statistical analysis of patient outcomes by nurse. The families of Linda's victims filed a class action lawsuit against the hospital, arguing that the suspicious death patterns should have been detected much earlier. My mother trusted Linda, said David Morrison, whose father Harold was one of Linda's final victims. She held my mother's hand when my father died. She comforted her, told her he was at peace. Knowing that Linda murdered him, that she was comforting my mother after committing murder, it's unforgivable. Dr. Chen, the physician whose statistical analysis exposed Linda's crimes, now travels the country training hospital administrators to recognize suspicious patterns in patient deaths. Linda Patterson operated successfully for 25 years because no one was looking for patterns, Dr. Chen explains. We trusted her because she was a nurse, because she seemed compassionate, because death in hospitals is normal. But when someone consistently has more patients die under their care, we need to ask questions. Linda Patterson remains in prison, where she reportedly works in the medical unit caring for elderly inmates. Even now, according to prison officials, she insists that her victims died peacefully and that she helped them find rest. The angel of death is finally behind bars, but her legacy serves as a chilling reminder that sometimes the people we trust most with our lives are the ones we should fear most. For more shocking medical crimes and true crime stories about those who abuse positions of trust, subscribe to Dark Discoveries. Because sometimes healing hands can become instruments of death.